H. pylori affects 50% of people or 50% of the general population globally. Some people are living with H. pylori with no symptoms, while to others who are in severe conditions tend to show the symptoms of H. pylori. The problem with people who have no symptoms of H. pylori will be complaining of things like acidity, whereby if they take the over-the-counter antacids, their issues are solved. The only problem with this, it can lead to gastritis. It also leads to ulcers. Now we are going to get into details about this H. pylori. Helicobacter pylori, or H. pylori, as most of you know it, is a bacteria that infects the stomach tissue. It leads to sores and inflammation on the lining of the stomach and the upper part of small intestines, leading to what we call duodenal ulcers. My name is Benta. I'm the one behind Benta Media channel. If you're new here, kindly subscribe, turn on the notification bell so that you can get a notification of our next video. Once the H. pylori infests on your stomach lining, it multiplies and produces an enzyme called urease, which converts the acidic nature of the stomach to basic. That is, it makes it less acidic so that it can favor it to survive inside the stomach. What I mean is, when it makes the acid basic, it can fully thrive inside that environment in the stomach. Therefore, it puts the stomach on a greater risk of the acid it produces and the strong digestive fluids. Well, what causes H. pylori? We got that. H. pylori is caused by transmission from one person to another through saliva. It is also caused by contaminated food. It is caused by contaminated water. It can also be caused by contaminated poop. And people at greater risk of contaminating the H. pylori are people living in developing countries, people living in overcrowded areas, people who are less observant of their personal hygiene. The general symptoms of H. pylori include a dull, burning pain in your stomach. This one can happen if you stayed for longer hours without eating. It can also happen in the middle of meals. It can also happen at night. Number 2, H. pylori can make you have a feeling of bloating or heartburn. This is because, as we said, H. pylori, when it gets into you, it makes the environment basic. That means the stomach is no longer acidic, or it's less acid. And we really need those acids to digest food that we take in. So once you take food and already you have the H. pylori, which has already made itself comfortable inside there, means your food is not well digested. So because of the long stay of the food in the stomach, there will be fermentation or production of gases out of that food which is there, which finds its way up. Because it's already full, it finds its way up, opening the sphincter muscles of the stomach on the upper side. Hence, when it releases those gases up, you now feel the feeling of burn, which is now what we call heartburn. Again, H. pylori can make you feel nauseated, still because of those acids. Because of this constant heartburns and constant indigestion, you can still have a feeling of getting tired. Therefore, when you have H. pylori, you commonly get tired, and also you get a feeling of satiety. The feeling of satiety means that you always feel like you're full. Yes, you want to eat, your brain is telling you to eat, but when you want to go and eat, already you're feeling full because of the many gases that are inside your tummy, or because of the acidic nature of your tummy. Again, if you have H. pylori, you can also feel short of breath. That is, you have some difficulties in breathing. Another symptom of H. pylori is weight loss. Weight loss comes along because you are not eating food to satisfaction. Things you can practice when you have H. pylori so that you can prevent this kind of pain that is usually associated with it, the kind of heartburn. First, stop chewing a lot. That is, like, if you have a common tendency of chewing gums, you can still avoid that. Because normally when you are chewing, you send a signal to the stomach that you are expecting something inside. And now once that something is not inside the tummy, you tend to get a lot of bloating. Make sure you don't skip meals. Always have something in your stomach. Again, you can also avoid taking over-the-counter NSAIDs. Over-the-counter NSAIDs include something like the diclofenacs, something like the aspirins. Always take something that is friendly to you. You can also avoid taking or eating foods that are rich in acid, things like kales, things like eating sour fruits. So eat some things which are friendly cheap. If you also have H. pylori, avoid smoking and avoid taking alcohol. Well, on to the diagnosis of H. pylori. H. pylori can be diagnosed through so many ways, but the common ways include: you can take a stool sample or a stool test, which is done in the lab. This one can be done through the microscopy or through the H. pylori kit, which shows if you have any strain of H. pylori. 2, we can do a blood test. 3, we can also do a breath test. This one is so common in the developed countries. We can also do an endoscopy to determine if you have H. pylori. On to the treatment of H. pylori. If the H. pylori has fully affected you, the doctor or physician will prescribe a triple therapy treatment, which involves 2 antibiotics and 1 PPI. That is something like the esomeprazole or the omeprazole. PPI means proton pump inhibitors. Your doctor can also prescribe 2 antibiotics alone so that it can counteract the effects of the bacteria. But the 2 antibiotics are given so that the bacteria will not have resistance on one of the antibiotics. The doctor can also prescribe PPI alone, that is the proton pump inhibitors, which include the esomeprazoles, omeprazoles, esomeprazole, depending on the severity of the infection. The proton pump inhibitors are prescribed alone if only the H. pylori has not so much affected you. So that means when the doctor counteracts the effect of its acid, it will maybe go away on its own. H. pylori is not something that will show symptoms. It only shows symptoms to those people who are severely affected by it. Some people live with it without symptoms. It has several complications. It can lead to gastritis, if untreated. It also leads to ulcers, if untreated. It can also lead to stomach cancer. That is to the worst part of it, because it causes the stomach tumors because of the recurrent ulcers on the stomach. A retest is done after 4 weeks of the treatment therapy to make sure that you are free of H. pylori. Thanks for watching the video till the end. If you find it interesting, share, like, and leave a comment down below. If you have not yet subscribed, kindly do. Thank you and bye.